Hello, students. This is Dr. Johnson, and welcome to Health Policy and Politics. This is one of my favorite lectures. Again, I want you guys to, yes, you're students, but you can still get involved in health policy and politics. So for this class, we're going to look at the difference between policies and politics, some of the roles in the legislative, administrative, and judicial branch of the government. We're going to differentiate what's the difference between the federal, state, local government, and their role in influencing healthcare and influencing our practice. Some of the identify the three policy issues that have significant consequences to nurses and to nursing, the profession, and some of the issues that affect how we advocate for patients. You're going to also demonstrate knowledge how to be a responsible and informed, politically active nurse. And you're going to know how to use technology or resources to get information about current health policies and some of the political issues in the healthcare industry. So this is a good time to be a nurse. We are empowered by our practice, our colleagues, American Nurses Association, which is our lobbying body in Washington, to get involved in health, in policies and politics. Okay, again, just with all my lectures, please know the key terms, very important terminologies. It will help you and guide you as you read your textbook. So then why do we not get involved? But, if you think about it, nurses, we work so much, we don't get involved. But think about it, we need to get involved in healthcare and in policy making. We don't get involved, other people that are not nurses will make the decisions for us, right? So it's almost like, healthcare decisions that are made in the hospital at the local level or in the state level or even in the federal level. We need to get involved. We have to be part of it. Because the policies affect our practice, it affects our patients, it affects that advocacy role that we always take, it affects the safety and the quality that we usually work for. And of course, that translates to less money for us, less money for the hospitals. And as we grow, actually, there's a lot of nurses in this country. Our number alone can get what we want passed. So as you continue with your education and in your practice, always keep in the back of your mind to get involved. And you don't even need to be physically involved. As we go through the lecture, you can see there are other ways to get involved without having to go lobbying in Washington or running for office. So what is health policy? Well, it's the actions that governing bodies what they do to obtain desired outcomes. So in our case, we do our interventions and then patient gets better. So health policy, the actions that governments do to get desired outcome. So a private policy is policy that is made by hospitals. So if you work in a hospital, they have policies, right? And that helps to govern what you do, with your patients, what the hospital does. The public policy is usually local or state or federal regulations and policies, and how do they allocate money. If you think about what happened in federal government, how much money can we give so that we can help with COVID? So they make decisions that will affect us locally, if in your local government or your state government or your federal government. So the RN need to be part of policy development because it helps to shape your practice. It helps. So if they're putting up a policy about something, make sure that you have a say because they are deciding what's going to happen to you. So it's very important aspect of practice. Now, examples of state, local, federal health policies are listed on the screen. So if you think about your local health policies, safe drinking water, emergency medical system, and even the immunization. Now let's move it to state, which is a little above. So we're talking about, let's talk about local would be New York City, right? The state will be New York State, right? So it governs our practice because, you know, the state decides what we do. So whatever a nurse does in New York City is what a nurse would do in upstate New York. And they have policies that determine food storage in restaurants, when restaurants can open, when restaurants can close. They decide what happens in healthcare facilities. So it's a statewide rules that affect state, right? Not just our local where we live, kind of. And then you have the federal. And if you think about federal, no matter how you look at it, it affects us, even though it affects the state and local. So for instance, Medicaid, Medicare will affect how hospitals are paid in New York State and how they're paid in New York City. So there are so many laws that affect the other laws. And can we become part of it? Absolutely, we can. And I will let you guys know as we continue with this lecture. So what are the ones that affect us personally for nursing, right? So with nursing, we have so many laws, but some of them are significant. So for instance, in 1910, they have the Nurse Practice Act that was established the scope of practice of what we can do, our education level. And many states actually use this to implement, use the State Board of Nursing to govern what their nurses would do. Then in 1921, you have the Shepard-Towner Act, and this was actually done for prenatal and child health centers to be staffed by nurses. Again, doctors didn't like it, but it stayed. It was the first federal policy that provide funding for nurses to be able to, work independent of doctors. I mean, we still have doctors to report to, but nurses can now visit patients at home and all that. Actually, if you think about it, it's affecting the nurse practitioners now, right? And then you think of the third one is the Hale-Burton Act of 1950, and that also is known as the Hospital Survey and Construction Act, and that provided federal funding for hospital construction. Again, that was the time where, money, fee for service, there was so much money out there in the healthcare industry that people started building hospitals, and many nurses were employed in the hospital, still employed in the hospital. So nurses moved from public health to hospital. In 1965, if you guys remember from our my lecture on payment, that Medicare program started, and it funded healthcare services for older and disabled patients. Again, this is very significant because these are the vulnerable population. If you don't give them money, they're not working, how would they pay for their healthcare and all that? And then you have the renal disease program of 1972. This was funded for dialysis treatment and renal transplantation for patients with kidney failure. And that leads to a new area of nursing practice, the dialysis nurse, the nephrology nursing. In 1983, DRG came into being. If you remember, we talked about DRG, and that's how Medicare was able to control hospitals from spending so much money in care of patients. And that leads to that fixed fee. I'll give you 10,000, whatever you do with that 10,000, it's on your own. If you go over it, you're going to eat the over. Right? So the DRGs came into being, and then in 2010, definitely affected us, the Obamacare that, well, before that was the Balanced Budget Amendment that provided direct reimbursement for NPs. This is a big deal. So NPs, if you're a nurse practitioner, you can bill. If you're a clinical nurse specialist, you can bill, and and you get paid independent of the doctor. So then the 2010, you have the PPE, the Obamacare. The Obamacare, of course, was able to provide care for uninsured or underinsured Americans. So there are so many of them out there that affect us, affect nursing. And these policies nurses were our lobbying body, American Nurses Association, were part of it, and we'll talk more about them. Okay, so in how do, when healthcare policies are made, who makes them and how does that even come into play? So again, if you're following the Congress, what's going on with the COVID stimulus pay and all those things. First, you have the executive, the legislative, and the judicial branch of the government. They are all involved in creating policies. So with the executive, which is the president, they recommend legislation, they promote policy initiatives that, that can, but they have the power to veto legislation from the Congress, and they're unable to enact a law without the Congress approving it. So it's like they're interdependent on each other. And unfortunately, sometimes you have politicians that use it to fight, forgetting that some of these policies are there that are affecting human beings' life. Then you have the legislative branch that has the senators and the Congress, the House, and you have 535 elected members. And their job is to enact laws. They do debates, they support some of these legislations that are coming out from the executive branch. They have the power to override the president's veto. So if the president vetoes their bill, they can override it. And we depend on them for some of the policies and some of the healthcare policies that affect us. And of course, they have other policies for other areas of, well, it's not just healthcare. And then you have the judicial branch. The judicial branch is the Supreme Court. They are the highest court in the land. They have, they resolve questions regarding regulations and, issues. They promote legislation initiatives. If you think about Wade versus Roe, they're the people that deterred, what, we're going to keep it. Somebody like me in OB is grateful. I know some people may not be grateful for Wade versus Roe, but if you think about it, it affects a lot of young women and women that are disabled, that may not be able to make choices for their body. So the Supreme Court, many times, it has been brought up to there for them to get rid of the law, and they have voted it down. So these three branches work hand in hand to enact laws and to make health policies. Okay, so what, if you think about some of the things, the legislative policies that affect us, well, most of them are not always healthcare, right? So it's mostly some of the public health issues, with COVID. Well, COVID is kind of like healthcare, but the things that come with COVID, like unemployment and people that lost their homes and things like that. So these three branches will have to do something to take care of that public problem, so that you don't have too many homeless people and people dying of hunger and stuff like that. So that's the importance of having, they're solving a public problem, a societal problem. Okay, so what are the steps in the legislative process? Okay, so they start with introduction of the policy, and then they will have a committee action, and then it will go to the House and the Senate for action, and then the president will now do his own action. It's very complex and convoluted process, but it has to be done. And if sometimes it takes years and years to just pass one policy. But once a bill becomes a law, it falls under the jurisdiction of the executive branch. They have to now carry it out. So the implementation of new legislation can be different from what it was intended, right? So when the Congress passes a bill, sometimes it's not what they passed the bill for that the bill is all about. So it's very convoluted, but the main thing is that we are instrumental in making sure that health policies are passed. So for instance, with the COVID, some of the money that is allocated for that COVID stimulus may end up taking care of the homelessness and the food and, you know, all that. It doesn't necessarily have to be just COVID. So the regulations are rules that the government issues, and, you know, and they have responsibility for administering the new law. The nurses, we play a very important role in making sure that there's input into that final regulation. So again, if they have a regulations about, let's use Wade versus Roe again, we have to, now nurses have to, sometimes you have arguments going on in the Congress, and, you know, our lobbying body, which is American Nurses Association, they're on top of it. They're using evidence-based research to convince legislators how to keep the healthcare, how to keep the policy either for it or against it. So just like the nursing process, you know, it goes into, you use your ADIPI, you're assessing, you're collecting information about the problem, and then we're analyzing it and for the fundamental issue about it, and then you're planning how will you now involve the input from many sources, in this case, research, experts, all those people, and then implementing the policy, using different strategies, and then evaluating if it works. So just like our nursing, you can use your, just like the nursing process, you can use that when looking at health policies. So what is politics? Well, you know, when nurses hear politics, they run. We don't want anything to do with politics, but it's really not what you think it is. It's just how do you convince and control other people? That's what politics is. So if how do you influence other people to do what you want them to do? So again, includes using money, using your brain, your expertise, your relationship, your talent. What we nurses, in our case, our talent is we know how to advocate, and we are educated, that we can use educated information to convince other people to do what we want. So we have political PAC, political action committees through American Nurses Association that does this for us. And what American Nurses Association actually want is money. Give them money and they will, you know, join them. By joining them, you're paying your due, and they use that money when they go and lobby Washington. And so other things you can do, like I promise you guys, you don't have to go become a lobbyist or run for office to be part of political, to be a political entity by yourself. Register to vote and vote. If you're qualified to vote in this country, vote. Don't, even if it's little, vote. Join a professional nursing organization like American Nurses Association, Student Nurses Association, New York State Nurses Association. Join them, because together you can make a bigger dent, because those are the people that will help to bring the issues to Washington. And work on candidates campaign if you have time. Volunteer to pass out pamphlets for them. Attend a Meet the Candidate town hall meeting, and speak up. Speak up about issues that are that you need to get to Washington. So for instance, during COVID, many nurses went to Meet the Candidates where they talk about PPE, staffing, safe staffing, and things like that. And you can visit policymakers. Some of them are really very nice. If you start with your local health policy maker. But I've actually written to Schumer, which is our senator for New York, and he replied. So they want to know what you want, because they're working for us. So you can write to them. And I think the textbook talked about ways that you can write, and it's better to email them, because if you send them paper, nobody opens mails nowadays, So send them emails, that's even better. And they talk about facts, and not many people have facts, and not many people, so email is better way to reach these candidates. So I keep talking about American Nurses Association. They're awesome. We have the federal American Nurses Association, but we also have, each state has their own state American Nurses Association. Like I said, it's a way to reach Washington without going to Washington. You tell them what is, what policy you want passed, you can write to them. And then it's one of the things, if you go into their website, they will tell you on all the things. You go to www.nursingworld.org, it tells you all the things that they're working on, all the policies that they're working in Washington, and what they have arrived, like what is the conclusion to it? Are they still working on it, or is it over? So these are some of the things they're working on: Medicaid, Medicare reform, advanced practice nurses to get that direct reimbursement. Remember I said that they can get reimbursement, but they still have to be attached to a doctor, right? But with this, they don't have to, a nurse practitioner can open their own clinic without a doctor. So they're working on that. Safe workplaces, safe patient handling, patient rights, access to healthcare, whistleblower protection for nurses. So all these things they are working for us. So you just have to tell them what you want. So I know one of the things that is on their plate now is COVID. How can they help the nurse at the bedside to be safe while taking care of a COVID patient? So these are all the things, current healthcare policies that you might see out there that is going on. Again, you don't have to really be into it in the sense that you're going there using a plaque and protect. Send them money, join them. Your dues actually help them do what they're supposed to do in making sure that our voices are heard on the Senate floor. Okay, so we are powerful. I don't know if you have noticed, but as you're going through these lectures and your classes and this semester, which is your final semester, nurses are powerful advocates. We have what it takes to make sure that our patients get the best care, but not just our patients, that we get our voices heard. So participate, vote, make sure that you after you get your license, that you join, or even before that, as a student nurse, you can actually join Student Nurses Association. They have benefits that entail, like, first of all, they have direct access to American Nurses Association, but they can give scholarships and things like that. So join Nursing Association if you can, and you actually can write, do tax write-off for them. So if you pay like $100, you can write off at the end of the year. Okay, I will see you guys in class.